most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapist on the internet.
In our opinion, of course, Bob.
Title of our program today, Must Know This for Best Results Using Inversion Table for Back Pain and Sciatica Relief.
Right. Now, this is from a therapist point of view as well as a personal point of view. I've used one of these with my back issues over the years, and there's some things that I really think you really need to know
and keep in mind when
Yep,
you're doing
to
this.
stay safe and have the best results with your back and leg pain.
By the way, if you're new to our
Oh.
channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And lucky you, right now we are actually we are
Oh.
doing a giveaway of a mattress right now. If you go to Bob and Brad, go to the giveaway section. We are giving away a mattress, and I'm going to make sure they give away one of their pillows too. The
Right.
Sleep Ovation
See what
mattress.
they can, yeah.
You're having pain, back pain, sciatica. You want to check out this mattress.
Yeah,
Really good
it
one.
is a wonderful
It's
deal.
premier. Also, you can find it in the contest on Facebook,
Mm-hmm.
Bob and Brad. If you want 60 seconds of us a day, just go to Instagram and Twitter, and you won't have to listen to us any more than 1 minute.
All right, Bob. So very interesting inversion table, hanging upside down, decompression, traction, all pretty much the same thing, and it can be done with a unit like this. So
And it doesn't necessarily have to be upside down. It can be at a slant, right?
yeah,
I mean,
and we're
not
going to
completely.
talk
We're
about
gonna
that,
talk about
in more
right?
details,
Okay.
right? So the first thing, if you're going to consider using one of these, is make sure you get a good quality one.
Sure.
I think this is made by Teeter. I've looked into them thoroughly. I've used this one. I had a different one that wasn't Teeter that I had used for my back problem a few years ago. This is well built.
Yeah.
This is their model LX9, which is their premier one, their most expensive one. It has a few more bells and whistles. And
Brad's got a background that he has an understanding of how things worked. I mean, do you want to just tell real quickly?
yeah, I was electrical mechanical mechanic technician, whatever we may call it.
But
But
I remember what you were.
yeah, it's been 20 years or 25 years extensively, and this is something I tinker
Yeah,
around at home. I got
Yeah, he knows products.
yeah. So this particular product is built well, and it really does what it's supposed to do. So the first thing you need to do is adjust it, and no matter which one you get, there's going to be adjustments. You have to adjust. I'm not going to go into adjustments in too much detail, but you have to get the leg adjusted right. There's an adjustment here. There's 3 adjustments.
I see there's a reading on here, Brad. Is
Yep.
that based on your height?
Exactly. On this particular, Teeter, what they do is they put your height on here, but it's not exact. So I'm 5'10", 5'10" and a half. I put on 5'10", and it actually works good for me. But if you have shorter legs and a longer torso,
Sure, right.
that may vary an inch or so. It gets you in the ballpark. Okay. The other one is you want to get there's an adjustment here that you only adjust once. There's 3 positions, and you adjust that once for you. And that one's a little harder to adjust. This one's very easy from person to
Sure.
person. And then also there's an adjustment here that there's 2 positions, and that allows it to fit your ankle so you have a snug fit.
Gotcha.
And that's very simple as well. So make sure you get it adjusted properly. Look at the manual. Oftentimes they have videos or a YouTube instruction for it. So look at that carefully. Make sure you get it adjusted well.
I think before we even get this far, though, Brad, you probably want to get this cleared with your physician.
Yeah, very good, Bob.
Yeah.
You're not just going to go if you have back pain or whatever you're going to use this for, even if you're going to do a maintenance program and you don't have back pain because you heard good things about it. You have to talk to your doctor, get it cleared, because it increases pressure into your eyes if you
Right.
have an eye problem or a potential problem. That could be a blood pressure.
Blood pressure
Yep,
issues,
yep.
right? So you want to make sure you are a good candidate to using this device.
Yeah. So once
So-
that's cleared,
Yep, you're good to go.
yeah, exactly. So let's see, where are we, Bob? Learn to adjust it. Now, once you get adjusted right, and the way you know it's adjusted right is, first of all, this is critical. When I push this down, this has really got a nice ratcheting mechanism. I'm going to push down and I'm going to get it snug. Not so tight that I lose circulation to my feet, but you should feel
Does
snug
this
in
loosen
there.
up just by pushing this?
Yep. It works better if you push in a little bit and then
Okay,
there it
gotcha.
goes.
Otherwise, when you ratchet it back, you just pull it back. You don't have to do anything
Nope.
else.
Yeah, you just push it.
pull
It
back.
rat. Yeah.
Okay,
Click, 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 and
nice.
it locks in. Yeah, it's very nice, very well padded, very comfortable. I'm always worried about these things because if you're totally inverted and your
Right.
ankle slip through there and you land on your head, that's a
Yeah,
problem.
that would be a problem.
Yeah.
So,
So
so that's really well made.
yeah,
We don't. It's
there is no
not of a
issues.
concern.
Exactly. Now you're going to learn, and this is something that takes a little bit of practice and have it adjusted just right. If I just bring my hands this way, I can go this far, and if I do this, it's there, and you should feel relaxed and in complete control of your angle. So this is horizontal. Nice thing about this, if you get one does not have a smooth back. I know my sister had one and it had kind of a chair thing here, and that's not what you want. You want it smooth, so when you start to invert, your body will slide, and then you get your traction or your
Right. I can't
decompression.
imagine that the other way would even work.
And some of them have pads and things like that. And
Yeah, you got to have a slippery surface.
right, exactly. So here we've got that, and you want to only start out at about 20 to 30 degrees. And I can control that here. Now, there's a strap. Can you show them the strap underneath, Bob? Maybe Bob doesn't even.
I don't know what it. Oh, this strap right
Yep.
here. Okay,
You
so I
can-
see that's set so that you can only go so far.
Right. I've got that set at about 60 degrees. So no
Gotcha.
matter what, I'm not going past that. But
Sure.
I can easily control that. I'm going to estimate I'm at 20 to 30 degrees. And the first time you use this, you should go back to that position and have a spotter. In other words, somebody with you, just in case something happens, and then they can help you get back
Sure.
up if you needed to.
So are you feeling traction at this point already?
At 23, it's very little. What you have to do is relax your abdominal and your core muscles through your breathing as well as relaxing it. And there's a slight traction. It's not much, but it's a little bit. And you're going to hold it there for 1 to 2 minutes, and it should feel very relaxing, very good. Then,
For the first time, that might be enough. I'm assuming
right,
that.
exactly. Then that's not it. Now, this is a key, and this is something that I have not seen anybody talk about in any of the videos for this, is get out, and it should still feel good. Stand up, verticals. Now the pressure is going back through your spine. The discs are going through a lot of changes from the inverted position to this position, and then it needs to feel good there. No sciatica pain or symptoms should be changed, or if anything, they should be better. Walk around for a little bit. Take some time away from it. As long as it feels good while you're performing the inversion and afterwards, as a result,
You're good to go.
into the next day, then you can go from 30 degrees to 40 or 50 degrees in 1 to 2 minutes to 2 to 3 minutes.
Yeah, you want to do it scientifically here.
Yeah.
Gradually increase angle and gradually increase time.
So each day you could increase 1 minute, and you could go another 10 to 20 degrees and go 1 day at a time. And you have to feel good while you're doing it. The symptoms are better as well as afterwards. And there's some judgment calls. If you did something silly, like, you had to go out and shovel and you didn't shovel right and you had a sore back, you may want to take a break from the inversion table that day. It all depends on your symptoms. It may help you tremendously as well.
Yeah,
that
it
day.
might help you after
Yep,
shoveling.
yep.
And this is where you have to perform a self-experiment, experiment basically. You're finding out what works for you and what doesn't
Right,
work for you.
right.
Everybody's so different.
And that's what Roger Teeter, the owner of this, I watched some of his videos. He says, this is an individual thing. You can't just come up with a program for everybody that's the same. It's actually the opposite. Each person is going to be a little different depending on your back situation. Now I'm going to go back to 60 degrees. And now when I did this on a regular basis, because I was having sciatica from my spondylolisthesis, which is another story. I did not have a bulging disc because it was a different situation. I would go back like this and my leg pain would go away. So I knew I was doing the right thing. And I'd hang out. Now, the first day I did this, I was one of those silly boys like I am oftentimes. And I went for 5 minutes. 1 or 2 minutes was good.
But you were fully inverted too.
No, I wasn't.
Oh, you weren't.
I wasn't about here. I wasn't that silly. But I got up from it. My leg was feeling better. I thought, wow, I'm right on the money. And I went to bed that night and my head was feeling kind of weird all I did that in the evening, and I went to bed. I kind of had a headache for the rest of the night. I
Sure.
did too much too soon, so I cut my time down from 5 minutes to 2 to 3 minutes. And after I did it for a while, then I could get up to 5 minutes because I got used to it, and the body adjusts and knows what's going on.
Adapts.
Yep,
Right.
exactly. But again, relax, relax. They have handles right here, and those handles are you can actually give a little more traction than the gravity is going to do. So it's like assist of the gravity. And the only reason you're going to do this is because it makes your leg feel better or your back feels better. This is definitely not one of those things that pain is gain.
Right.
It's
You're
just the
looking for
opposite.
a reduction.
Yeah,
And
exactly.
so the table did help you for a number of years.
It did. I had leg pain. Actually, I could walk only 3/4 of a mile. My leg always would go numb. I started doing this along with some exercises for my core, and that went away. And at that time, I did sell my inversion table. So there's a huge market for them for sure. But part of the reason was in my workout room where I do my exercises, I didn't have a lot of room for this. So I thought it was
Sure.
just kind of getting in my way. My symptoms were gone that way. I finished out my spondylolisthesis rehab, and I still do with my other exercises.
So interesting enough, I brought this up to a neighbor this weekend that we're going to do a review on this, and
Uh-huh.
he has one.
Oh, good.
And I happened to see this neighbor. It was probably a half year ago, and he was having sciatica symptoms, and he was going in to evaluate for whether or not he's going to have surgery. And I told him if he can hold on, we've done a video on this.
Mm-hmm.
Quite often the discs can get reabsorbed,
Yep.
or they can get eaten by those microphages, or they can, the body can heal yourself if you can make it through the pain. If you're not getting weakness in the foot, and
Right.
he listened, and he actually got the table, and he's been able to manage it. And he says now he gets pain once in a while right here,
Yep.
but no longer down the leg. So it's worked really well for him. So he does it like 5, 6 times a day.
A day.
Yeah,
Wow.
yeah, he does it a lot.
But he's been doing this, and he knows his
he
his
knows
body.
his body, and
Right.
he knows it. So he's using it. I think it's not a bad idea if you have the ability, and
If you get positive results like
Right.
that, you're and you've been doing it for a while, you know what's going on. That is a good question. People are going to say, "Oh, actually, I did." There is a study by university in the United Kingdom where using this, and I'm going to do it. We're going to do a video on this. 55% of the groups had less surgery using this as part of
Wow.
their treatment. So there's some science that we're going to talk about with this either. But as far as a general rule is how long do you stay inverted, and do you invert completely up vertical? I'm going to say some people may respond well to 90-degree inversion, complete inversion. I'm thinking I don't think you have to.
Right.
You may. Roger Teeter himself goes to 60 degrees. That's what I went to. I think
Sure.
you get plenty of traction. Some people want to go all the way only if you follow the rules that we went through. It's got to
Sure.
feel good while you're doing it. And there's some exercises in full inversion. We're going to do a video on that too, that we want to talk about therapeutic value. But probably 10 minutes is probably the maximum. That's what Roger Teeter does. He's been doing it
10
for
minutes.
years.
Wow, that seems like a long time.
I went 5 minutes at the most, and that was more than adequate for me. Once a day, I don't think I ever did daily, 3 to 5 times per week. But if you have good results, like the gentleman you talked
Sure.
about, multiple times a day, has to give you good results.
Again, we can't say that enough. It's going to be different for each person. So
Right.
we can't predict
There
how
you
you're going
go.
to react to it. So nice device.
It is.
We'll have a link below if you
There
want
you
to buy
go.
one. So thanks everybody for watching.